Congratulations on beginning your orthodontic treatment and your journey to a confident smile. Here are a few tips that will help you along the way. Remember to clean your aligners before wearing them. Wash your hands with soap and water, and handle only one aligner at a time. Clean both the inside and the outside of each aligner. To insert your aligner, gently push it over your front teeth and using your fingertips, apply gentle pressure over your molars until the aligners snaps into place. Remember, your aligners works only if they are in your mouth, so wearing them consistently will keep your treatment moving forward. Aligner removal is simple. Use your fingertip on the inside of your back molar to slowly pull your aligner from your teeth. Repeat it on the other side, then remove the aligner. Let Dr. Deepak Victor know if you have difficulty removing your aligners. Each tooth is surrounded by a periodontal ligament. This ligament is surrounded by fluid and tiny fibers that connect the teeth to the surrounding bone. When the aligner is put on, it immediately starts applying pressure to the targeted teeth. The fluid in the periodontal ligament prevents the tooth from moving at first. But within a few seconds the fluid is expressed from the area, and the tooth moves to its new position. The ligament is only 1/4 millimeter thick. So, the teeth can move only a tiny distance at a time. The pressure from the aligners compresses the blood vessels on the one side of the ligament, and dilates them on the other. After 4 to 6 hours of sustained pressure, the compressed ligament responds to the stress by producing enzymes and chemical messengers. After a day or two of pressure, those chemicals began to stimulate the production of bone cells called osteoclasts and osteoblasts. Osteoclasts break down the bone near the compressed ligament, meanwhile osteoblasts build new bone on the opposite side of the tooth, preventing it from becoming too loose. If the pressure of the aligners is interrupted for any significant length of time, the process must start over from scratch. That's why it's critical to wear the aligners at least 20 to 22 hours per day. If the bone doesn't get reshaped, the teeth won't stay straight. When the bone around the tooth finish rebuilding, it's time to take the old aligners and move on to the next set. This rate of bone rebuilding can vary considerably between individuals. It usually takes longer for adults than it does for children in adolescence. You may switch to your new set just before going to bed. Rinse the new aligners and wear them 10 hours straight. This helps the new set to settle better as they are worn continuously. If you feel discomfort, ask Dr. Deepak Victor if you should take any medication. New aligner discomfort generally subsides in a few days. Each aligner moves the teeth a little bit further until you get to the last set and the treatment is done. As the aligners are virtually invisible, no one needs to know you are straightening your teeth, and you can drink water while wearing them. If you are drinking anything other than water, you will need to remove your aligners to protect them from damage. It's also a great opportunity for good oral hygiene. Ideally, you should brush or floss after every meal or snacks, but if you don't have a toothbrush with you, rinse your mouth and clean your aligners by holding them under running water. Please don't upgrade your aligners before the prescribed number of days, even if you feel the current set of aligners have become loose. If you upgrade your aligners before the prescribed number of days, or if you were irregular in wearing them, you may end up with ill-fitting aligners. You can notice this by the space between the aligner and teeth surface. Always store your aligners in the case to prevent loss and damage. If you misplace your current set of aligners, please go back to the last fitting one immediately and contact Dr. Deepak Victor. Hence, for this reason, please keep your finished sets safe in their respective pouches. Enjoy food with friends and take photos with confidence. Aligners doesn't interfere with your social life the way braces can. Following these simple guidelines will help to improve your treatment experience and your comfort. If you have any other questions, please feel free to contact Dr. Deepak Victor. Hope you enjoy the confidence of your new smile.